secondary contact with contaminated fresh water. That's all it takes to start the chain of infection.
This is the intermediate host, freshwater snails. Parasite eggs, shed from infected humans, contaminate the water and infect these snails.
Ugh, mosquitoes.
Inside the snail, the parasite multiplies. A single infected snail can release thousands of infectious larvae, called Cercariae, into the water.
Cercariae can penetrate intact skin directly. Within minutes, they are burrowing their way inside.
Once inside, they enter the bloodstream. First destination, the lungs. Then, the liver.
The first sign, an allergic reaction at the site of larval entry. It's swimmer's itch. It's unpleasant, but the real invasion is happening inside.
Now I'm burning. The sun moved inside my head.
Weeks later, the acute phase begins. Katayama fever. It's the body's systemic reaction to the migrating parasites and the first eggs. High fever, chills, cough, muscle ache.
This is not the flu. Then this morning, just red, bright red.
I hear you, Alex. We'll figure this out.
You said you were fishing. Were you in the water, waiting?
Yes, for hours, up to my waist.
Given the fever, the rash, the water exposure, and now gross hematuria, I have a strong suspicion. We need to test you for a parasitic infection immediately.
In the urine, the lab found this, an egg with a terminal spine. The classic sign of Schistosoma hematobium, the cause of urinary schistosomiasis.
But then, in his stool sample, they found this, an egg with a lateral spine. This is Schistosoma mansoni.
In the urine, the lab found this, an egg with a terminal spine. The classic sign of Schistosoma hematobium, the cause of urinary schistosomiasis.
Alex, we have the results from the lab.
Alex, you have schistosomiasis. Specifically, your stool test is positive for Schistosoma mansoni.
What? Mansoni? But the blood in my urine?
Exactly. This is what makes your case clinically remarkable. You are presenting with the classic symptoms of one species, but the diagnosis is for another.
After entering your skin, the parasites, the schistosomula, migrate. They travel through the tiny blood vessels, hitching a ride in your circulation, pass through the lungs, and eventually make their way to the...
Once mature, they pair up for life. And this is where the migration begins.
They travel to the liver, where they mature into adult male and female worms over several weeks.
Once mature, they pair up for life. And this is where the migration begins.
Now, Schistosoma mansoni almost always migrates to the mesenteric veins surrounding the intestines, laying eggs that pass into the stool.
But in your case, it appears some worm pairs have aberrantly migrated. They've settled in the veins around your bladder, a place where hematobium normally lives.
and they are laying their eggs there. Those sharp-spined eggs are what's tearing the walls of your bladder as they try to exit your body. That is the blood you're seeing.
The blood is the most obvious sign. But the real danger is from the eggs that don't make it out. The ones that get trapped in the tissue.
I get it now. That's what it means.
If left untreated, these eggs can travel. They can go to your lungs, causing severe inflammation, or even worse, to your spinal cord, which can lead to paralysis.
And the chronic risk? Constant inflammation in the bladder wall from those trapped eggs leads to fibrosis and granulomas. This is a direct known cause of bladder cancer.
The treatment is a drug called praziquantel. It's highly effective against all schistosoma species.
Exposing them to Alex's own immune system, which can now attack and destroy them. The worms die and are broken down.
Praziquantel is the drug of choice. In some severe cases, other supportive drugs may be used to manage inflammation or secondary infections.
Praziquantel paralyzes the adult worms. It damages their outer layer, their tegument, and floods them with calcium, locking their muscles and exposing them to the host's immune system.
Alex, we have the results from the lab.
Well, Alex, your follow-up tests are clear. No more eggs, no more blood. The treatment worked.
But you need to understand, this parasite is a huge problem in many parts of the world. Prevention is key.
Now, prevention means avoiding wading or swimming in fresh water in endemic areas. If you must have contact, dry yourself vigorously with a towel immediately after.
A simple day of fishing almost cost him his life. A lesson learned from an invisible hunter.
Stay informed, stay protected.
What complicated medical story should we simplify next?
Let us know in the comments below.
If you love this deep dive,
don't forget to subscribe and turn on notifications.
thank you for watching.